More than 20 million Americans have type 2 diabetes, and the number of people with the disease is growing so fast that it is quickly becoming an epidemic. A recent article in the journal Diabetes Care reports that approximately 40% of Americans have diabetes or prediabetes. The number of people who may be affected by diabetes is staggering, and as such, it is important to understand what type 2 diabetes is and the difference between type 1 and type 2.
The classification of diabetes is actually a moving target. Right now, it's classified fairly simply as type 1, which is the one where the immune system destroys the beta cells that make insulin. So you don't have any insulin. Usually has a rather explosive onset, and you need to be on insulin for the rest of your life. Much more common and much more epidemic is called type 2 diabetes, and that's both genetic and environmental. We say that the genes load the gun, and weight gain and being sedentary makes the gun go off for diabetes.
In type 2 diabetes, the person's body becomes resistant to the effects of insulin. Insulin is a hormone secreted by groups of cells within the pancreas. The pancreas contains enzyme cells that produce two hormones, insulin and glucagon. Both of these hormones are secreted directly into the bloodstream and together regulate the level of glucose. When working properly, insulin lowers the level of glucose or sugar in the blood and increases the amount of stored carbohydrate in the liver. When the body becomes resistant to insulin or doesn't make enough insulin, the glucose stays in the bloodstream and does damage to the blood vessels. This damage puts the person with diabetes at risk for cardiovascular disease like heart attacks and strokes, kidney disease, eye trouble, and problems in the lower extremities, especially the feet and legs. Other type 2 diabetes symptoms include excessive thirst and hunger, frequent infections, blurred vision, cuts and bruises that are slow to heal, tingling, numbness in the hands, feet, recurring skin, gum, or bladder infections. Sometimes the symptoms of type 2 diabetes can be difficult to pinpoint, and in some cases may not even be apparent. That's why it's so important to educate everyone about the risk factors for diabetes and its complications. Understanding who is at risk is a crucial component in bringing type 2 diabetes under control as early as possible.
So type 2 diabetes is actually a very interesting disease in that there's a very strong genetic component and almost a requirement for an environmental component.
When Dr. Buse refers to the environmental component, he's talking about lifestyle factors, including obesity and the lack of regular exercise.
100 years ago, diabetes was a rare disease because you had to have a huge genetic component creating deficiency in the ability to make insulin. Now, as we've gotten older and heavier and more sedentary, we have more insulin resistance. And now it takes just a bit of a genetic burden with regards to the inability to make very much insulin for diabetes to be expressed.
According to the National Institutes of Health, 66% of American adults are obese or overweight. Obesity and being overweight is the #1 risk factor for diabetes, and 9 out of 10 newly diagnosed patients with type 2 diabetes are overweight. When an overweight or obese patient is diagnosed with type 2 diabetes, he or she should be evaluated by a healthcare professional to undertake a diet and exercise program immediately.
Exercise is a wonderful adjunct therapy for people with type 2 diabetes. Exercise certainly can help patients control weight, but even more so than that, it improves insulin sensitivity or decreases insulin resistance.
Self-monitoring of blood glucose is the best test for day-to-day diabetes control. By using a tiny drop of blood and a meter, patients can see how food, physical activity, and medicine affects blood glucose levels every day or by the hour. Even a modest weight loss can reduce cardiovascular risk factors. Many patients living with type 2 diabetes take several medications to help manage their blood sugar. There are several different types of medicines, and they are often used in combination to achieve optimal blood sugar control. But recent discoveries are helping patients and their doctors find new ways to manage diabetes.
We have learned so much about type 2 diabetes and how it develops over the last 10 years. It's breathtaking. But what we have established is that many tissues are involved in the process of developing diabetes. And we've started to take advantage of that knowledge to create new drugs for treating type 2 diabetes. But there are also now drugs that really are diabetes drugs that actually promote weight loss. In the old days, in 1994, all the drugs that worked in diabetes actually promoted weight gain.
Many diseases can be devastating and make us feel isolated and out of control. Fortunately for people with type 2 diabetes, a combination of lifestyle changes and a variety of effective medications can give them power over the disease and the chance for a healthy future. It's important to emphasize that they are in control and not the diabetes. To answer any specific questions you may have, be sure to contact your healthcare provider.